This video demonstrates how to set up and perform X-rays of the spinal column. In this video, the first projection for each region of interest will be described in full, and subsequent radiographic projections will be described briefly, highlighting the differences only. Equipment required includes the following: upright bucky, a table bucky, 8 by 10 inch cassettes, 14 by 17 inch cassettes, 10 by 12 inch cassettes, a protective lead shield for the patient, an X-ray generator and X-ray tube housing assembly, a control panel located behind a protective lead barrier, a computer radiography system, and positioning aids such as sponge wedges and radiolucent sponges. The cervical spine is routinely imaged using 5 projections. The cervical spine series can be performed either lying on a table bucky or standing against an upright bucky. For the purposes of this video, the projections using the upright bucky are demonstrated. For each projection of the cervical spine, place an 8 by 10 inch or a 10 by 12 inch cassette lengthwise in the upright bucky. Set the source to image receptor distance, or SID, to 40 inches. Turn on the collimation light and align the central ray perpendicular with the center of the image receptor. For an AP projection, select the upright bucky setting and the small focal spot on the control panel. Set the exposure parameters to between 65 and 70 kilovolts, or kV, and between 12 and 16 milliampereseconds, or MAS. Place a protective lead shield over the anterior aspect of the reproductive organs. Ask the patient to stand with their back towards the image receptor, with their arms down to the side, and to open their mouth widely. Position the patient with the mid-sagittal plane of the mouth aligned to the midline of the image receptor. Align the lower margin of the patient's upper incisors so that it is perpendicular to the base of the skull. Ensure that the central ray is directed onto the midpoint of the open mouth. Line up the image receptor with the central ray. Collimate on all 4 sides of the mouth to include the first and second cervical vertebrae. Position the left lead marker on the image receptor within the collimated field. Stand behind the protective lead barrier and make any necessary adjustments to the exposure settings. Ask the patient to remain still and say "ah" during the exposure. Expose the cassette by pressing the prep button, and then, when ready, press the exposure button. After the exposure is completed, inform the patient that they may relax and breathe normally. Remove and process the cassette. To obtain a radiograph of the cervical spine in an AP axial projection, ask the patient to remain standing with their back against the upright bucky. Adjust the kV to between 65 and 70 and the MAS to between 10 and 16. Ask the patient to extend their chin slightly and check that the mid-sagittal plane of their neck is aligned to the midline of the image receptor. Ensure the patient's shoulders are touching the image receptor. Angle the central ray 15 to 20 degrees cephalad. Ensure that the central ray is centered to the 4th cervical vertebra. Collimate on all 4 sides of the neck to include the base of the skull to the 2nd thoracic vertebra and the lateral soft tissue margins of the neck. Expose and process the cassette. To image the cervical spine in an AP right posterior oblique RPO projection, leave the SID at 40 inches and adjust the exposure factors. Rotate the patient to an angle of 45 degrees from the image receptor with the back of their right shoulder against the image receptor. Center the patient's neck to the midline of the image receptor. Angle the central ray 15 to 20 degrees cephalad with the central ray focused on the 4th cervical vertebra. Collimate on all 4 sides of the neck to include the base of the skull to the 1st thoracic vertebra and lateral soft tissues of the neck. For the LPO projection, a similar technique is used, but the patient is positioned at a 45-degree angle with their right side away from the bucky and the back of their left shoulder against the image receptor. Ensure that the oblique neck is centered to the image receptor at the level of C4 and collimated appropriately. Complete the exposure and process the cassette. To image the cervical spine in a lateral projection, first adjust the exposure settings. Ask the patient to stand with the left shoulder against the upright bucky, with their arms down and to the side. Reposition the lead shield to protect the reproductive organs. Set the SID to 72 inches. Position the patient with the mid-coronal plane of their neck aligned to the midline of the image receptor. Ensure the patient's left shoulder is touching the image receptor and ask the patient to relax and drop their shoulders. Align the central ray to the level of the fourth cervical vertebra. Collimate on all four sides of the neck from the base of the skull to the first thoracic vertebra, and including the anterior and posterior soft tissues of the neck. Position the lead marker. Ask the patient to depress their shoulders and to suspend breathing on full expiration during the exposure. To image the cervical spine in the lateral swimmer's projection, adjust the exposure factors appropriately. Ask the patient to raise their left arm and rest it on top of their head. Instruct the patient to relax, drop their right shoulder, and slightly raise their chin. Adjust the SID to 60 inches. Align the central ray in the mid-coronal plane at the level of the first thoracic vertebra. Collimate on all four sides of the neck to include the fourth cervical vertebra to the third thoracic vertebra and the anterior to posterior soft tissues of the neck. Prepare and complete the exposure on expiration. Review the cervical spine images. For each projection of the thoracic spine, position a 14 by 17 inch cassette lengthwise in the table bucky. Set the SID to 40 inches and then move the protective tube housing to one side. For an AP projection, select the table bucky setting and the small focal spot on the control panel. Set the exposure parameters to between 70 and 75 kV and between 25 and 32 MAS. Position the patient supine on the table with their arms down and to the side. Rest their head on a pillow. Place a protective shield over the patient's reproductive organs. Ensure the mid-sagittal plane of the thoracic spine is aligned to the midline of the radiographic table. Remove the pillow to place the upper thoracic spine in contact with the radiographic table. Instruct the patient to slightly raise their chin. Place a compensatory filter on the collimator over the area relating to the upper thoracic spine. Align the central ray to the image receptor. Move the radiographic table to ensure that the central ray is centered to the seventh thoracic vertebra. Collimate on all four sides of the thoracic spine to include the seventh cervical vertebra and the first lumbar vertebra, and the right and left lateral borders of the thoracic spine. Position the lead marker on the image receptor on the right side of the patient's body. Ask the patient to remain still and suspend breathing on expiration. Expose the cassette by first pressing the prep button and, when ready, expose the cassette fully. After the exposure is completed, inform the patient that they may relax and breathe normally. Remove and process the cassette. For a lateral projection of the thoracic spine, position the patient on their left side. Ask the patient to place their arms and elbows up so that they are flexed towards the head. Set the kV to between 75 and 80 and the MAS to between 30 and 36. Place a radiolucent sponge under the patient's waist and ensure a true lateral position is achieved. Position the mid-coronal plane of the thoracic spine to the midline of the radiographic table. Move the table to direct the central ray onto the seventh thoracic vertebra. Place a lead blocker behind the thoracic spine and a protective lead shield on the right side of the patient's waist. Collimate on all four sides of the thoracic spine from the seventh cervical vertebra to the first lumbar vertebra to include the whole thoracic spine. Expose the cassette on expiration. Review the thoracic spine images. For each projection of the lumbar spine, place a 14 by 17 inch cassette lengthwise in the table bucky. For an AP projection, set the SID to 40 inches and then move the X-ray housing assembly to one side. Select the table bucky setting and the small focal spot on the control panel. Set the exposure parameters to between 70 and 80 kV and between 25 and 32 MAS. Ask the patient to lie supine with their arms down and to the side. Line up the central ray with the image receptor in the table bucky. Align the mid-sagittal plane of the patient's spine with the midline of the radiographic table. Move the radiographic table to ensure that the central ray is directed onto the mid-sagittal plane at the level of the iliac crests. Collimate all four sides of the lumbar spine from the 12th thoracic vertebra to the sacrum and include the right and left lateral borders of the lumbar spine. Position the lead marker and stand behind the protective lead barrier. Ask the patient to suspend breathing on expiration and expose the cassette when ready. Remove and process the cassette. For an AP left posterior oblique projection, LPO, of the lumbar spine, set the KV to between 75 and 85 and the MAS to between 40 and 45. Instruct the patient to place their right arm across the upper chest and their left arm to the side of the body and to flex the right knee. Rotate the patient to a 45-degree angle with their right side away from the radiographic table and place a 45-degree radiolucent sponge behind the patient's back for support. Move the radiographic table to ensure that the central ray is centered to the third lumbar vertebra, 1.5 inches above the iliac crest and 2 inches medial to the elevated anterior superior iliac spine, or ASIS. Collimate to include from the 12th thoracic vertebra to the proximal half of the sacrum and the right and left lateral borders of the lumbar spine. Expose the cassette on expiration. A similar technique is used for the AP right posterior oblique, or RPO, projection of the lumbar spine. However, the patient is positioned so that the back of the right shoulder is in contact with the image receptor. To image the lumbar spine in a lateral projection, set the KV to between 75 and 85 and the MAS to between 40 and 50. Ask the patient to roll onto their left side and to flex both knees. Position a radiolucent sponge under their waist. Align the mid-coronal plane of the lumbar spine with the midline of the radiographic table. Ensure the patient is in a true lateral position and place a lead blocker behind the lumbar spine. Move the radiographic table so that it is centered to the top of the patient's iliac crest. Collimate to include from the 12th thoracic vertebra, the entire sacrum, and the anterior and posterior borders of the lumbar spine. To obtain a lateral projection of the L5 to S1 joint of the lumbar spine, maintain the patient's current lateral position. Move the central ray to the sacral region and use a smaller cassette. Set the KV to between 85 and 90 and the MAS to between 80 and 100. Move the table to ensure that the central ray is aimed at the point 2 inches posterior to the ASIS and 1.5 inches inferior to the iliac crest. Collimate all 4 sides of the lumbar spine to include the 4th lumbar vertebra to the proximal sacrum and the anterior and posterior borders of the L5 to S1 lumbosacral joint. Review the lumbar spine images. When imaging the sacrum, use 10 by 12 inch cassettes. For an AP axial projection, set the SID to 40 inches and angle the central ray 15 degrees cephalad. Select the table Bucky setting and the small focal spot on the control panel. Set the exposure parameters to between 70 and 75 kV and between 30 and 40 MAS. Ensure the patient is positioned supine on the table with their arms down and to the side. Check that the mid-sagittal plane of the sacrum is centered to the midline of the radiographic table. Move the table and direct the central ray to the sacrum midway between the level of the symphysis pubis and the ASIS. Collimate on all 4 sides of the sacrum from the 5th lumbar vertebra to the apex of the sacrum or coccyx, and include the left and right lateral borders of the sacroiliac joints and symphysis pubis. Expose on expiration and process the cassette. To obtain a lateral projection of the sacrum, ask the patient to lie on their left side on the radiographic table with their arms up, elbows bent, and knees flexed. Adjust the exposure factors and align the mid-coronal plane of the sacrum with the midline of the radiographic table. Move the table to ensure that the central ray is aimed at a point 3 to 4 inches posterior to the ASIS in the mid-coronal plane. Collimate on all 4 sides of the sacrum to include the L5 to S1 joint, the coccyx, and the anterior and posterior borders of the sacrum and coccyx. Review the images. Smaller 8 by 10 inch or 10 by 12 inch cassettes are generally used to image the coccyx. For an AP axial projection, First, set the exposure factors and ask the patient to lie supine on the table with their arms down and to the side. Ensure the mid-sagittal plane of the coccyx is in the midline of the radiographic table. Move the table to ensure that the central ray is aimed at the sacrum, midway between the level of the symphysis pubis and the ASIS. Collimate on all 4 sides of the sacrum to include the 5th lumbar vertebra, the base of the coccyx, the left and right lateral borders of the sacroiliac joints, and the symphysis pubis. Expose on expiration and then process the cassette. To obtain a lateral projection of the coccyx, ask the patient to lie on their left side on the radiographic table with their arms up, elbows bent, and knees flexed. Adjust the exposure factors and align the mid-coronal plane of the coccyx with the midline of the radiographic table. Move the table to ensure that the central ray is directed to a point 3 to 4 inches posterior and 2 inches distal to the ASIS in the mid-coronal plane. Collimate on all 4 sides to include the distal sacrum and coccyx and the anterior and posterior borders of the sacrum and coccyx. Expose and then process the cassette. When finished, review the images.